Welcome to Jelenia Góra, Poland. We are sitting here with KCM patient Hanna. Hanna, welcome to Poland.
Thank you.
Tell us a little bit about your story, the story of how you came here, what was the problem you faced?
Well, I always been skinny because I always dance and do a lot of sports, and I don't normally like eating. And suddenly I just couldn't stop eating. So I gained between 20 and 30 kilos in less than 4 years. And since then I haven't been able to lose all the weight that I gained. I did diets, I did sports, and it didn't work.
Yeah, it didn't work, yeah?
No, it didn't work. So in the end I have asked my dad what solution I could have, and he gave me the solution of having the surgery done.
The gastric sleeve surgery?
Yeah, the gastric sleeve. And I've been looking through different clinics, but this one was the only one who gave me all the support that I needed, and I trust them.
In terms of the communication with the clinic, they gave you a fast appointment?
Yes, they did. It was absolutely brilliant. Everything through email or WhatsApp or any way that we could.
Flawless communication, yeah, they say.
And I had all the information, all the gastric sleeve information. What is the surgery about? What do they do to me? How would I recover? And it was brilliant. It was absolutely brilliant. Everything was really clear. There was maybe 2 or 3 questions that I had personally, but with all the information that you gave us, there was no doubt of anything.
And tell us, how was the process inside the hospital? You had your consultations, diagnostic first?
Yes, I did have the day before the surgery. I had all the consultations, diagnostics in the clinic. Brilliant, I have to admit. They were taking me everywhere when they needed me, and they did everything to make sure I was fine. And that's it. And then the day after, I had my surgery. And here I am.
And one important factor always that a lot of patients ask is, how is the process during the hospitalization? Do you have somebody taken care of?
Oh, I have to say now that the nurses team and the doctors team, the entire clinic is brilliant. I mean, they take care of you. If you take someone with you, they will take care of that person as well.
Companion.
Yes.
Okay.
And every 5, 10, 15 minutes maximum, they always come to the room to check you up, to make sure that you're fine. If you have pain, because I had pain the first night, I called them and they were there straight away.
Okay.
They were absolutely amazing. They just came over and said, pain? Yes, they came over, they bring me the painkillers. They were absolutely brilliant. I have never been treated this way before, so I'm really happy.
Nice to hear that. So tell us, Hanna, that means you were 2 days after the procedure in the hospital, yeah?
Yes.
For 2 days? And now another 2 days and then you're going back home? Or?
Yes.
I'm
going to spend 2 nights in the hotel.
Yeah.
And then I'm leaving home.
Wow, that was quite quick. So 6 days altogether?
Yes.
Okay. Yeah, is there anything else we should say to other interested patients?
Well,
interesting questions?
Questions, no. If you actually think that you need this procedure done, I would recommend this clinic straight away. Because, as I said, I am really apprehensive and I can't see the procedure itself, and I don't like to feel pain, and I'm really picky when I feel pain. And I have never actually felt that much pain. I've been looked after, I've been always asked if I needed anything. So it's been brilliant. Oh, and the coordinator.
The coordinator, your personal assistant at the hospital.
Yeah, she was brilliant.
She did a good job.
She did a brilliant job. Any questions that I had apart from the clinic itself, I mean outside, where could we go to get some, because I like to take souvenirs back home, and she told me where to go, and she's brilliant.
So that is the additional support that the hospital is giving to the patient and the
the coordinator, she is amazing. She did a really good job, and she's always there if you need anything. He came over in the morning of my surgery. I did ask the questions that I needed to ask, like when can I drive again, and how would I...
The questions that are on your mind.
Yes. And even after the surgery, he came twice to see how I was.
Okay.
So he was brilliant.
Yesterday he called.
And yesterday, the day after my surgery,
he checked on you also.
He checked on me, calling the nurses and talking to my companion. So it was brilliant as well. The care that you're giving us is amazing.
That is important that the patient feels very taken care of. It
feels like home.
Especially if he's not in his own country, in a new system and in a hospital. Yeah.
It basically is that. You're not at home. You don't have all your family with you.
Yes.
And the people from the clinic make you feel that you're at home. And you can't pay that. That is something that, for people like me, for example, I'm really scared of things.
Not only you.
No, but there's lots of people like me that they don't like. Just the thought of surgery is a big thing to deal with. And I felt like home. I did. And it's brilliant.
Well, thank you for the interview.
My pleasure.
With